The Your-Space project, which we are implementing in Jinja, is a project that was mainly based on the idea of addressing challenges that young people face in accessing sexual reproductive health information and services. Of recent, we have seen teenage pregnancies on the rise, so we want to see how we can try to address that. We have seen Izombo, we have seen Karamoja, Busoga region has been on the news for quite some time, so those are issues that we want to address, that we see a reduction of young people that are getting pregnant in these times, especially with limited access to these services. We have quite a number of other activities. We have radio talk shows that I have shared, and then the peer educators that we have trained today for the 3 days will be conducting door-to-door mobilization. Of course, with the times that we are living in, we are hoping that they will still maintain what we have shared with them, especially maintaining social distance, ensure that they sanitize themselves to prevent them from getting the coronavirus, and then which will later affect our programming and project implementation.
I learned about family planning methods, their benefits, the side effects.
Asomeseza nako how to use a condom kubanga like mbadde ngenda mu field naye nga sigitegera bulungi gikozesa for both a female and a male condom.
I learned how to communicate when I'm interacting with my clients or sellers.
We have equipped these young people with information on the various methods. We also given them, equipped them with skills on how to engage their fellow young people in their communities. And so we want themselves to reach out to their other peers with this information and where they can access these services to ensure that we do not have another pandemic within a pandemic. I'm talking about the teenage pregnancy pandemic that is slowly growing up across the country.
So as we do the training of the peer educators, we also inform them that we have an application that they can use as an assistance for them to support their clients to reach, to have the service, because this app has, healthy workers that are attached to it, and most of this information is always there. They can go there, read and understand. Where they need any questions, they can ask, and then responses can be gotten.
The key expectations of this project is, one, we hope that we shall increase number of young people that have information on sexual reproductive health. Many young people at the moment have wide myths and misconceptions about these family planning methods. A lot of these misconceptions are hindering the utilization of these services, and this is what we are looking at to address.
We're able to use a SARA system that we use for referral, where a peer educator uses the USSD codes to record the client's data. This data will be also entered onto the voucher card, and it is the voucher card that the client takes to the healthy facility, and then they get the service. This voucher card costs only 1,000 shillings, and then this 1,000 shillings is paid to a peer educator, and for all the services that will be on that card, they will be given at this client for free. By using this innovation, we hope that it will help us track this data. So the voucher being at 1,000, it is very cost effective, and it will increase the uptake of family planning methods, in the communities where the Your-Space project is operating.
We hope that the few days training has been quite beneficial to them. They have gained a lot of skills, a lot of information, and we're now waiting to see the change in our communities. We're expecting a reduction of teenage pregnancies. We're expecting a reduction in the number of young people that are dying because of engaging in unsafe abortions. So we're expecting that we shall have a number of young people that are taking up these services and living to see that they achieve their dreams.